Hello, hello, how are you? I hope you're keeping well and you're keeping safe. My name is Myron Obura and I'm the lead events consultant at Majestic Events Kenya. And I'd like to welcome you to our channel where we discuss all things that are related to events. Now, last week we had an amazing session with Leonard Asher, who, in summary, said that we are here in this situation, but the only thing that can get us through is resilience. Okay? So from the comments that I read, that I saw after doing the show, I am sure that you were motivated and encouraged after the session. Now, if you're here today and you didn't watch that session, please go back to Majestic Events Kenya and watch the video that we aired on the 1st of April, and I'm sure you will also see what we were talking about. Okay, so now, today, we are here on the What's Next series to tackle the question, how to remain unlocked in our minds. And to help us with that is a counseling psychologist and a mental health professional, Nyambura Chege, from Ngewa House Rehabilitation Center. So, karibu sana.
Thank you very much.
How are you doing?
Very well.
Thank you so much for coming today. I'm really happy you're here. And the reason why is because at the beginning of this year, in as much as work was getting back to normal, I still felt that the temperature in the industry was a bit low. So I kept asking myself, I think we need someone who can help us. And I remember talking to myself, as Leonard would say, having a meeting with myself. I even had a meeting, a session with some industry players, and we're like, we need a psychologist to come and help us. Mm-hmm. So I am excited and I am happy because I know having you here will be very helpful.
Thank you.
So let's start with, tell us about yourself.
Okay. My name is Nyambura Chege.
Mm-hmm.
I am a member of the Kenya Counselling and Psychological Association, which is our professional body.
Mm-hmm.
I am, my background is in counseling psychology, and I am but I have additional training on detection and interventions for alcohol and drug abuse.
Okay.
I'm currently the administrator and the residential counselor at Ngewa House, which is a rehabilitation center for women only recovering from alcohol and drug use.
Okay.
Yes.
All right. And you're also a mental health professional. Tell us a little bit about that.
Mental health professional. That's an umbrella term for everybody who works with mental health, or they treat mental health issues.
Okay. So why did you get into it? Let's get a bit personal. Let's start there.
Well, when you do, help, a mental health professional is in a profession of it's a helping profession. So most people who are in helping professions have had either an incident in their lives or something in their background that has inspired that. So for me, I would say I had really what would be diagnosed as a mental issue or condition in my teenage, but nobody diagnosed it, nobody knew what it was. I also did not know what it was until I was seated in a psychology class and discovering I'm checking all the boxes in these symptoms, So that I would say was my number one motivation. Mm-hmm. Yeah, because I felt like if there could be help, I would have been helped much earlier and would have prevented other things. Yeah, so I felt if I would be that person I needed at that time, then I want to be that person.
Wow. So it was motivated by a personal experience that you had.
Yes.
Wow.
Yeah.
That's nice. Question. When you were talking earlier, as we were, getting ready for this session, I was like, what exactly is psychological or psychology counseling? Because I always thought it's like the movies. You go, you lie down on a couch and stuff like that. Do you mind telling us and defining us what a counseling psychologist does?
Okay. as psychology is a broad, what I'd say, a broad term.
Field, yeah.
Yes, a broad field. And there are different types of psychologists. There are counseling psychologists, clinical psychologists, industrial psychologists. So depending on what you want to focus on, then you branch into the specificities of psychology. But a counseling psychology majorly, like what you see in the movies, are the ones that actually treat through what we call psychotherapy, which is talk therapy. You sit with them and they talk and you get feedback. Mostly that's the major methodology of treatment with counseling psychologists.
All right, so it's mostly talking.
Talk therapy, yes.
Could you walk us through, if I came, if someone wanted to come for a session, how could you give us in brief how that process would go?
Okay, like I said, the mental health professionals are many, and depending on what you are looking for, like the service that you're really in need of, that is what will actually dictate which mental professional you need to see.
Okay.
I'll give you an example.
Yes, yeah.
Or just probably define what different mental health professionals do. For example, a psychiatrist is first a medical doctor who has specialized in mental health or psychiatry.
Okay.
So if you have a mental illness, you need more than the therapies. You need medicine. And out of all the mental health professionals, a psychiatrist is the only one who is licensed to dispense and prescribe medication.
Okay.
So in that way, if you have a mental condition that needs medication, then you're best suited to see a psychiatrist. But you can't work with a psychiatrist alone, because we know other than chemical imbalances in the mind that require somebody to have the medication to balance them out, there are other factors that lead to mental illnesses, which are social factors, environmental factors. And so they work now with both the psychiatrist who takes care of the chemicals with the medication, and then they work with the therapists or the counselors or the psychologists on the ground to deal with the other factors that kind of precipitate the mental illness.
Okay. Good. So a lot of people, me included, think counseling is almost the same thing. Is there a difference between counseling and a psychologist counselor?
Yes, there is. And I will say for most, what would say as a counselor, you see, Marion, like, you're very approachable and very warm.
Oh, thank you.
So if you give if your friends came and opened up to you, like 3 or 4, you or them might label you a counselor.
Okay.
And that's what actually most people are doing, even now, calling themselves a counselor, when actually what they're doing is either issuing out advice or their own opinions. Okay?
So I can be a counselor.
A label.
Okay.
You would label yourself.
She has labeled me. Yeah.
Well, but that's not what it is. It's not advice giving. It's not opinion giving. It is a counselor is actually somebody who's gone through the training to be able to help someone with their mental health issues. So a counselor is more like specified, because you might find like
a psychologist counselor or a counselor?
No, a counselor.
Okay.
You might find that they're in one line of treatment. Like, for example, if somebody goes for training for addiction counseling, they're just in that line, and so they would be an addiction counselor.
Okay.
All right. Or if they've done school psychology, then there'd be a school counselor. But a psychologist has a broader spectrum of clientele, yes, and so they're not limited to just treat school or a rehabilitation center. They're able to see a broad. But the main difference would be, out of all the mental health professionals, a psychiatrist, a psychologist, a counselor, a therapist, all these words, the main difference is in the training that they have received, the methodology of treatment that they use, because then you'd find a counseling counselor a counseling psychologist, is more, the methodology is talk therapy, but a clinical psychologist, the methodology is on assessments and tests.
Okay.
All right. So the differences between all these mental professionals, their training, their methodology of treatment, the hours that they do under supervision, okay, and then like practicing under supervision, and then the practicums and the internships. So based on what that individual has gone through, then it will qualify the title that they have at that point. And it's important to know most psychologists, or they have their qualifications up on the wall. So it's good to check so that you know if you're having a right fit for the service that you require.
Okay, so I think what I'm hearing is it's good to know the difference.
Yes.
Because, as you said, someone will call themselves a counselor, and someone will think, oh, that's as well as talking to a psychologist.
Yes.
So it's good to know that there's a difference
There
between
is.
a psychiatrist, a psychologist, a counselor, a therapist. So thanks for elaborating that.
Yeah.
Now, in our industry, and this is an events channel, we're going through a lockdown, which is affecting our livelihood. For someone who is not very well versed with the differences of psychiatry, psychologist versus counselor versus therapist, what would you advise they do?
Okay, I would advise that they educate themselves.
How?
Because we are in the Google era. You can.
Let's bring it home.
Yeah.
I'm at home. I'm not feeling. I can't come out of bed. I
Yes.
just don't feel like doing anything. I mean, going into Google is probably the last thing. If I can't get out of bed, or I can't seem to dress or anything,
Right.
going to Google is not even. I can't even open my laptop or my phone. What would you suggest they do?
All right. To know the differences between these mental health professionals.
Like they know they need help.
Oh, they know they need help.
They
Okay.
know they know. Remember I was saying at the beginning, I knew we need help.
Yes.
I knew that for us to start airing something on YouTube, it would have to deal with the person.
Okay.
Yeah. So
All right.
if someone knows they need help,
Yeah.
where do they go first?
Actually, that's a good question. And those are the ones that know they need help are actually doing so much better because they have that awareness.
Okay.
Some people don't even know that they do need help.
Okay.
They're just experiencing all these kinds of symptoms that they are not familiar with, or probably they have been experiencing these symptoms and not really thinking that they could get any kind of help.
Okay.
Because most people who suffer from mental illnesses, like something that can fit in a diagnostic criteria, they do not know that they have a mental illness. Yeah. So it is, first of all, if you are aware that you need help, and how you get aware sometimes is how you're feeling is starting to interfere with your overall life. You can't sleep, or you're sleeping too much. Your eating is different. You're either eating too much or eating too little, or not eating at all. You are finding difficulties in just doing your normal things, like even getting out of bed or doing your dishes. Or so some people might see that because there's been a lot of talk on depression, and they might think, okay, I'm
depressed.
I'm feeling so sad today, I am depressed. It's not good to do a diagnosis on yourself. That's why you need to seek professional help. But there's a difference. If you, like now with this pandemic, a lot of people are feeling what I would say is pandemic melancholy. Just sad,
Wait,
Things are not...
Wait. Did you hear that? Say that again.
Pandemic
melancholy.
Yes, and it's a normal reaction to what is happening. If you have lost a job, your income, if you have lost a loved one, even through death, or people are losing relationship because of all sorts of things. Families are breaking up, we're getting separated. So these kinds of losses, the normal reaction is that you will be sad.
Yes.
Yes, you'll be sad. And then it's compounded on the fact that everybody else has something going on. and you can't go and lay on them, your things.
Someone was saying, I think I even saw it in one group, they said, we are not on the same boat, but we're going through the same storm.
Mm-hmm.
So if that's pandemic melancholy, how then, because I'm feeling sad, using your words,
Yes.
how then do I know the difference between a pandemic melancholy, as you
Yes.
said, versus, oh my gosh, I need to get help?
I need, yes. Like I'm saying, most people cannot differentiate. They cannot differentiate. But if it is something that is starting, if you're sad, it will interfere with your social life. You will not feel like you want to talk to people more, on most days. So you will sort of isolate. But if it gets to levels where, and sometimes that's why it is important to keep checking up on other people, because you're the one who will notice it for them.
Oh, nice.
That they are with the isolation is not just that they are sad, because probably if you're sad yesterday, today if I meet you, you're very, happy-go-lucky. But for someone who's actually has depression, that's not the case. They are not able to snap out of it. They're not able to be given a pep talk and just, feel good and cheer up and have the next day be. So I like that analogy that we are in the same storm but not in the same boat.
Yeah.
Because we are going through different things. There are people mentally who are just sad. They've lost some things or they've lost some people, but they are not depressed. Okay, so it's a whole spectrum, and it's good to notice to notice that. And also, then that means that whatever we are doing right now, we need to be very sensitive on what we say to people.
Nice.
Yes, because if you're just sad and I'm depressed and you say, oh, yesterday I just had coffee and everything was fine, so you just need coffee.
I feel like you're talking to me.
I need coffee and I have not been
coffee.
and I've not been able to get out of bed for the last 2 weeks. Surely your solution will not work for me.
So you're saying be careful when you're giving advice, or even when you're
Just
having a normal discussion?
Be careful about what you say to people, because now what that does to me, of course you have good intentions. You're trying to help me feel as good as you did yesterday. But how I will interpret it now is a different way, because I have been having coffee. I have been trying to do these things, but it's not working. I'm just sad, and it's not improving. I'm actually getting worse than better. So what I would interpret that as is you are invalidating what I'm going through. Because for you, it's easy. You can give yourself a pep talk and walk out of the door. For me, I can't. See?
I like what you say. I think that's important, that we should not invalidate what someone else is feeling or going through and say, know what, snap out of it, like move on. Is there, so you've said something very important, which is the importance of having people around you, the importance of reaching out.
Yes.
Because it's the other person who is likely to, if
to
both
notice.
Of us are the way, you would probably notice that I have an issue.
Yes.
Or maybe there's something just not right about Marion, then me as Marion would know.
Yes.
So in terms of duration, what would that, because you said I'm sad today, I could be sad tomorrow as well. I mean, as you said, pandemic melancholy. After the 26th announcement, I think I was there for a couple of days.
Yeah.
When do you think it's now as an observer?
Yes.
Yeah? Let's assume I keep calling someone, they're sad today, I give it 3 days, they're sad. When do you notice, when do I as the observer, as the friend, say, okay, I think now we need to get you help?
Yeah. All right. And I would say, like, if I was your friend Marion and I know how you talk, I know probably your eating styles, your sleeping styles, and then I notice something is shifting. You're not eating how you used to eat. You're not sleeping how you used to sleep. You're a happy person, but now you're not. You're not so social. You want to just remain home. You're changing. I can see that you're changing. I would say you need help immediately. so that it doesn't escalate to something worse, because it will gradually get worse if it's something that is actually just roasting.
Yeah.
It's something that is likely to get worse. So if somebody notices that about a person that they know, the first help should be just to ask, what is happening, what is going on, are you
okay?
are you
So
okay? Immediately. But for something like depression, like a clinically diagnosed depression, even how we diagnose it, somebody has to be in that same mood for 2 weeks.
Say that again.
So,
2 weeks.
Yes, 2 weeks, and your mood is not changing. You see, Marion, if you're sad today and you won a lottery tomorrow, your mood will change drastically, Cindy.
What? Yes.
But for somebody who has clinical depression, since it's not the events that are happening around them, it is what is happening in their brain. The chemicals are not where they should be. So they are not able to come out of that mood they're not able by themselves. Even if the circumstances are changing, they're not able to come out of it. So if somebody is just same mood 2 weeks, that's how we diagnose that's clinical depression and not just sadness.
That's helpful.
All right.
2 weeks.
Yes, but you shouldn't wait 2 weeks. You see, if you notice your friend or your relative is, then it's good to find some intervention. At least start from the family level. Then when you think there is no improvement, then you will know now which mental health profession is best suited for the kind of symptoms you're observing.
Then I'd say it's important at this time during this pandemic, find a way of staying connected.
Absolutely.
Because then no one, if you isolate yourself, no one, from what you're saying, no one will know that there's something amiss.
Yes. And you see now, isolation is also a symptom in itself. So this person is not deciding. The way they are feeling, they are so overwhelmed, they're not able to deal with anything. So isolation is a way of also just helping themselves to cope. They're removing themselves from additional pressure that might come from elsewhere. Okay, so they're trying to help themselves in how they are reasoning. So they might not be isolating intentionally,
but they just find themselves.
But they are, yeah. So as much as people are not reaching out to you, it's good to reach out to them. If you find that someone is not reaching, because you might expect them to reach out because they are seeing that they need help, but they are not. For them, that's the help they're giving themselves to just stay at home.
Stay at home. Yeah. I would say, I talked to someone, I think last week, they were like, I've just decided to stay at home for the next 1 week.
Mm-hmm. Yes.
And in actual fact, they were not very upbeat.
Mm-hmm.
So maybe I should call them.
Yes. Be very proactive about checking up on your family, on your friends.
Okay.
Yeah.
And different industry players. This is Kenya, and I will be very blunt. Counselling psychologists are not people who are like, oh, I have a counselling psychologist. Her name is Nyabura. It's not something we flaunt and shout about, like someone will say, oh, my therapist. My therapist the other day was saying,
yes,
it's actually almost better to say my therapist than to say
my psychologist,
my counseling psychologist. So maybe you can share with us, what are the benefits of seeing someone like you who is a counseling psychologist?
All right.
Because I know you've worked with organizations.
Yes.
You were telling me just before the interview that you've worked with people like across the whole age spectrum, all the way to above 50. So what is the benefit?
Okay, first I would like to address what you said in the beginning, that in our context, people are not very open about it. And part of it is how we are socialized. We are socialized, kangumu, jikaze kiwanaume,
Yes.
So that in itself, the fact that you are saying you have gone to find help is looked at as weakness.
That's true.
And people don't want to look weak, so they will strain and struggle and keep everything bottled up until they break.
Is that common in men and women, or is it mainly men?
No, in our context, it's actually even both. Like, for example, if you see, I think in African context, the women that are labeled as strong women, those are the women who have gone through hell on earth, and without asking for anybody's help. That's how we categorize women as strong, because they have endured.
Everything.
No, that's actually, well, it has its place, but I think the way we are wired as human beings, and even just what people are experiencing mentally, because mental illnesses are not imaginary, they are real conditions and people have these real conditions. So we cannot all jikaza kiwanaume and bottle everything inside. We need the support that is necessary. And so looking for help is not weakness. In fact, vulnerability is strength.
I am going to make that tagline. Looking for help is not weakness.
It's not weakness.
Yeah.
Yes. In fact, it takes a lot of, you have to be very brave to be vulnerable. So it is strength in itself that you're seeking help. You're discovering that I am not able to do this by myself. Even if it's just help from a friend. If I just, tonight I can't sleep, I feel like all these emotions are overwhelming me, and you talk to someone, that's important. Yeah.
Yeah.
So, but sometimes some support is beyond. Like if I came to you and I told you I have not eaten the last week, I have not slept for 14 days straight. Even if you're
possible, it's just that. Is that just an example?
Okay, it's an overstretched analogy, but you could actually lack sleep. Like insomnia is a real condition, and people cannot. You either cannot fall asleep or you cannot stay asleep. So it's not very far-fetched.
Okay.
As much as I'm stretching, it is a very far-fetched. So if it's you, Marion, and I'm your friend, and I come, you see your support. I'm not likely to get the support that I need from you, right? It is beyond you, because what can you do?
I mean, other than listen,
yes,
give you my advice, cancer, kind of way,
labeled cancer. But you see, that support is beyond you. So that's how you get to help other people realize that even if I can't help you in this particular situation, there's someone else who's best suited to address these kinds of issues. And that's why it's important now to see mental health professionals. A counselor is someone who takes you through normal life stresses issues, like loss, for example. If you've lost a loved one, what you're experiencing is grief. And sometimes you're not able to process all the emotions that come with that by yourself. So if you see a counselor, you don't have a mental anything. You just are a normal, functioning, healthy human being, but with overwhelming emotions that you can't cope.
Going through a normal stress
Yes.
life situation,
Yeah.
like the loss of a loved one.
By yourself, you feel like it's overwhelming. So it's important then to see a counselor to help you process through those kinds of emotions.
Okay.
Yeah. And then for like a counseling psychologist now is if you are experiencing symptoms that are not just from normal life stressors. It's beyond. Like, for example, you are finding comfort in cutting yourself. All right? Or you are starting to have very suicidal ideations. You feel, what's the point? I feel hopeless, helpless. What's the point of it all? See, I just do something and check out. It would be easy. If you're starting now to experience stuff like that, now that's for a counseling psychologist or a clinical psychologist. Or even eventually, when you do sit with a counseling psychologist or a counselor, now they're able to refer you to who is best suited for the kind of support you need. Because you could be talking to someone and you feel, hey, this one is a psychiatric case. You actually need to be on medication so that your mood improves. So then you're able to be referred. Yeah. So those are the importance. You can go for any. You don't have to wait until you have a full-blown mental thing to go see a professional.
Yeah.
No, sometimes it's just, and then because we're trained not to. Our profession is that we don't judge you First of all, we don't know you, so we really can't judge you. And sometimes that's why it's better than talking to a family member or a friend who that's the fear that you'll constantly be having. You know, if I say I feel like I want to check out, what will my mom say if she had me say that? Yeah. What will my sister say? You know, even likely the response that you'll get from that is actually very unataka do you know how many people are in worse situations than you are and you want to check out, you know?
Check out.
They're trying to reason with something that is not, you know, for you it's real. You're feeling that, you know?
I'm done with this
yes.
life. I just need to hit the grave.
You're feeling that even though you're eating every day and sleeping in a warm bed and, you know, but you're still feeling it. So somebody cannot come and say, you shouldn't feel it. You are.
You know, case in point, we did have someone like that who was at a point of wanting to commit suicide.
Yeah.
Now, what would you suggest we tell them? Okay, for example, if you had someone who's around and they wanted to commit suicide,
yes,
what would be the best action?
The best action is to refer them to a mental health professional.
Not deal with it yourself,
because
or counsel them, or
the support. Make sure that you're encouraging them and you're there for them. They know that you are there. You are hearing what they're saying. Sometimes you might not understand why, because when you look at their lives, you're seeing, but you have it so good. Why do you? You know, there are so many people who have it worse than you. So you almost feel like you are not supposed to feel how you're feeling. But since that's how they are feeling, the best thing you can do for them is support and make sure they are understanding that you're hearing what they're saying.
Could you give us an example of how that discussion would go?
Okay.
Say I tell you right now, Nyabura, I can't deal with this thing.
Yeah.
I last year I had to let go of my people. I've been kicked out of my house. My landlord at work. I have no office. I can't afford food. My kids, I mean, I had to send them to someone else.
Yeah.
I think I'm done. I'm actually, you know what? I think I just want to end it. I just want to end my life.
Yeah. I said, Marion?
Actually, can I be blunt? I want to commit suicide.
Wow.
What would you say?
I would say, Marion, that's a lot of things for one person to handle. And I see what you mean. It is obviously overwhelming for you, and I'm hearing what you're saying to me. But I would recommend that we see someone first who is able to give you more support than probably I am able to do as of now.
Okay.
Would you be willing to see?
Yes.
Would you be willing to see someone who would give you more support?
Yeah.
To be able to just reconcile what you're feeling.
Yeah. So, what would you give us an example of what would not be a good way of dealing with it?
Sasa where you want to kill yourself. There are so many people. Steven, Connie, who is not dealing with this pandemic? We're all in the same boat, you know? Everybody is experiencing what you're experiencing. Even me, I experienced that last year, by the way. You can snap out of it. You know? It's like, Ata, I know someone else who's in the same situation as you, and they're so happy. Why are you sad? Huh? Those are terrible ways to try and...
Why don't you start if it's money? I mean, who's a mayai? You know,
chukua bucket anza kuzungusha watermelon, you know?
Yeah.
Yeah, you need to, I think when now you start being the judge, because now that's judgment already. Okay. You have passed judgment on this person. You have evaluated them as probably not grateful enough for what they have or where they are in life. And so you have sat in that seat and judged that based on what is happening in their lives, they do not have any right to be thinking or feeling the way they are feeling. That's not helpful.
Okay.
Because it is reality for them. Just because you don't understand the dynamics of it does not mean that it is imaginary. They are actually experiencing it. So to sit and invalidate, rubbish it, belittle them, that's not right.
Okay. Thanks for that. It's helped a lot of us know how to deal.
It is not right.
So, as a counseling psychologist, Nabura, what would you advise people generally? As you said, we're in the same storm.
Yeah.
We're not doing events. Some people, most of us have to figure out how to make an income.
Yes.
What strategies or coping strategies would you suggest?
Okay, that's actually a very good question, because when we are experiencing hard times, the natural thing is to want to get out of that situation, right? So if you're feeling sad, you want to feel something else other than sad, and that can be tempting to find coping mechanisms or coping skills that are feel good now, or quick fixes. And sometimes those quick fixes are not always the healthiest of coping methods, because then what some people are likely to do as a way of coping, for example, I'm so sad or I'm so stressed I can't sleep, so I need something to help me sleep. So I might start taking sleeping pills, start to drink, start to smoke something to help me feel a bit calm, and then that thing that you're using to cope at that point can be problematic later. It could be an onset of something that graduates to an addiction, all right? So it could fixing things for you now, but then
it's not actually sorting out the issue,
or become even a bigger issue in the long run. So coping, I would say, it is normal to feel like you want change, you want to get out of the way you're thinking or the way you're feeling at that moment. But based on our circumstances, like now, let's take events, for example. We are not likely to have 1,000 people gather tomorrow or the day after or the month after. It's a circumstance that's not changing, but yet you are experiencing that emotion. You just want out, but you might find out without going back to the same way in how you used to do things. And I think that's the hardest for most people. And then if ever, possibility thinking, if ever events come back, I can always get back to that. But currently, this is what is the most important thing for me.
Why this will be hard for? This is a hard thing.
Yes.
Because again, it is pushing us to have a meeting with ourselves. Because I've looked at, I think people should get that book right now, especially because we're not doing so much. John C. Maxwell, Thinking for Change, because those are different types of thinking that can help us. And I think what I liked about what you said was realistic. Let's be realistic. And then after you're realistic, how about possibility? What is possible to do that? So you're saying changing the way we think.
Yes.
What else?
Coping in healthy ways. We had mentioned about negative, like unhealthy ways to cope, which is quick fixes and just feel good now, sorts of solutions. Coping in healthy ways includes, first, please remain connected. I know you might not be seeing all your friends or your relatives as you would want or as much as you would like, or even, in contact. But there are other ways to keep connected. Call, do Zoom meetings, do WhatsApp video calls. Stay connected. Because we all need people. We are social beings. As much as this is very convenient for some people, they're finding it even easy. You see, like we are saying, most it's a symptom of depression, for example, to isolate. It becomes even easier to isolate because people are not able to
have meetings.
Yes.
And, the normal get-togethers
Yeah.
that they're having.
But you can stay connected in other ways. And then healthy things that you're doing, eating right, of course. making sure that you're not overstretching yourself as well, because you can't do everything. You can't do everything, and you cannot live tomorrow today. In recovery, in addiction recovery, we use a phrase. We say, one day at a time.
Yeah.
Which is so practical, because you cannot live tomorrow today, right? You can only live today. So do what you can today.
Okay.
Tomorrow will have its share of
its own issues.
Of its own issues. Then you can do that tomorrow. Don't try and pile up. Oh my gosh, I wanted to go to school this year. It's not possible. What will I do next year? You see, you overwhelm yourself with that kind of thinking. So just one day at a time.
Okay, so you said eating right.
Eating right.
I was going to say fafanua. Expound.
A balanced diet. We're talking about mental health.
Yes.
But health is overall. You cannot be healthy, for example, Marion, in one eye and unhealthy in the next eye and say you're healthy.
Okay.
All right? So health is holistic. So if you're not eating right, your physical health, if you're not taking care of your physical health, it is automatically going to affect your mental health. If your mental health is affected, it is going to automatically affect your physical health. So that's why I'm saying when you're eating right, it's a balanced diet so that you're getting the nutrients you need.
So no junk.
To help your brain function at its optimum, because this is when you need it, right? You're shifting perspectives and thinking in all the different ways that you had not been thinking like before. So you need a healthy brain, and for that, you need to be eating.
So no junk.
Healthy. Wow. I am not a doctor,
But
medical doctor, but I'd say eat right. Nobody is saying don't do ice cream or do, but
in moderation.
yes, moderation.
Okay.
Yes.
Nice stuff. Is there any other strategy you'd like to share today?
Remain connected, healthy habits, and also just eating healthy is part of healthy habits. Healthy habits also includes that you sleep, because there are people who worry themselves and they can't find sleep. You keep ruminating about all the stuff that has not been done or you have not achieved in the time that you hoped you would. So you miss out on your sleep. Those are healthy habits are the things that we should do every day to help ourselves. Because if you don't sleep, you continue to tear and wear your body out.
Yeah.
Which is more stressful to handle the next day, because the next day you will have pains and aches that you did not have the previous day. You see, so that's something you have added on to your stressors.
Okay.
So healthy habits: eat right, sleep well, hydrate.
I was going to say water.
Exercise, remain connected, do the things that you enjoy. As
like
well.
that, yeah.
Yes, even now, if you cannot go out on restaurants and and do stuff, you can still do things that you enjoy. Learn new things, like you're saying now that people are not doing a lot of things. Learn new. You can grab on a new hobby. Start reading. You might find that you actually like reading,
Yeah.
but you just never had the time to do it. Find new things to do. You can teach yourself new skills
Yeah.
that could actually bring you money in the long run.
Yeah.
Yeah.
So, if these strategies that you've given us of having healthy habits, am I right or wrong to say that if I'm not able to do these healthy habits,
Yeah.
on a regular, like I'm not sleeping well, is that a cry for help?
It is actually
Is that an indicator?
It's
Because
an
remember, I think what you've said before is, what we're discussing before is, if you stay connected, someone else can tell that you need help.
yes.
So, God willing, we are most of that. Let's assume we are not there yet. If I see myself not sleeping well, I've told you about sleep because that's a very common thing that people have. If it's not sleeping well, would that be an indicator for me to say, okay, maybe I need to start watching myself? How do I go about that?
Yes, absolutely. When you realize that the things, you see, these are things we need to live.
Yeah.
If you don't sleep well, it will interfere with your with your mental processes, concentration, focusing, even just creative thinking. Thinking becomes impaired when you can't sleep or when you have not been sleeping well. You feel more fatigued, you have no energy in your physical body. All those are consequences of not sleeping. So these are things that we need to do. It's not that you need to sleep well, you need to eat right, you need to exercise, drink water, and all those things. It's a part of being our... Okay, do you want to?
No.
It's a part of healthy living, all right? So if you find that in your life, your sleep patterns are being interfered with, your diet habits are being interfered with, that is actually an indication that something is not okay. Yes.
It's funny that you say sleep. Let me tell you why it's very relevant to events.
Yeah.
You don't sleep very well because when there are events, we work through the night. If I have a wedding tomorrow, I'll probably sleep at 1 and wake up at 5 and stuff. And to say that, there's a question someone has asked: what should one look out for when it comes to sleep patterns as unhealthy? I guess what they're trying to say is, what is an unhealthy sleeping pattern?
All right. Studies have shown that averagely an adult should sleep 7 to 8 hours. Right?
Is that okay? Let's have some
I've
real
said
talk.
studies have shown. Disclaimer.
Okay, disclaimer.
Yes, 7 to 8 hours, and this means that you are able to sleep through. All right, the 7
to 8
uninterrupted.
hours. Yeah,
That's what it means. All right, so if you have problems, but okay, this is probably not true for most, because some people need less sleep than others. There's some people, if they sleep 6 hours straight, they're good. That's healthy sleep for them.
yeah.
All right, but you cannot tell me that 2 hours sleep every night is healthy sleep for anybody.
Okay,
All right.
2 hours.
So there's some people who need less than 7 or 8. They can do they can do 6 and be or 5.5 and be very alert tomorrow, and it's not affecting any other part of their life. So there are those people who can do that. But how you start noticing that it's becoming unhealthy for you is that the pattern that you had, for example, let's pick 6 as an average. You would sleep 6 hours uninterrupted. Now you're finding it hard to fall asleep. You're taking longer to fall asleep, or you're finding it difficult to stay asleep. You might fall asleep, but wake up in 40 minutes time. So very interrupted sort of pattern. Or you're just not falling. Your difficulties in falling and staying asleep. That is an indication that your sleep pattern is being interfered with.
That's a problem.
And you should look into it, because it means something is going on.
Wow.
Yeah.
Okay, there's another question here. So there's a question here from Esther. What is making people more anxious? Is it the virus or the hysteria in the media? What's your take on that? That's a very interesting question.
Yeah, I'd have to give my
Just
personal
give your
personal
because
opinion.
I don't think is that's a
But anxiety, if things are not going how we had planned for them to go, it's normal to feel a bit anxious. Or if you do not know what to expect, it's normal to feel anxious. Like if you had a call today and somebody told you a close relative or a friend has been diagnosed with the COVID-19, it's normal to feel a bit anxious, because you don't know what next. What you don't know, you don't know what to expect. So it's a normal reaction to either not knowing or just feeling like you don't know how you would handle it. So that can make you anxious. But I think that's right. Remember when you talked about you should challenge the popular way that people are thinking. So if everybody is coming, like a panic mode all the time, that is likely to raise up your anxiety. Yes, your anxiety generally.
It could be the
So
virus.
if you're sitting and watching the news every day, and you're hearing the numbers are going up in what county, the numbers are going up in the county that your family resides in, you're likely to get more anxious than you were, without that kind of report. So then I would say, the part that we said about challenge the popular way that people are thinking. Don't remain in spaces that continue to add your anxiety. If you're even hanging out with people and all they're talking about is how things are bad and how things are not likely to get better and everybody's just in the pandemic melancholy, it's not healthy to keep doing that day in, day out. You will be affected. And the fact is that your anxiety levels will likely to go up.
Okay.
Yeah.
So I think
realistic thinking.
Yes, that's what I'm picking.
Yeah.
All right. Before we wind up, let me just say thank you to those. I think this is someone was saying this is a very sober discussion.
Okay.
Something that's very reflective, and I think you've pointed out a few things that people didn't think were things to monitor in terms of mental health, like sleeping and the way you eat and not walking. So that's a good thing. So we have on the chat, we have Esther, we have Joseph Ochola, nice stuff. We have Diana Njoki, we have Catherine Nambisia. Thank you so much for joining us today. We're doing a lot of thinking today. So as a way of winding up, before I even go there, what would you, is there anything you would encourage people to do other than what you've said? Is there something we've not talked about that you would like to add and say, do this? Is there anything, or we're okay for now before?
What can I say? Other than taking care of your overall health, relational health.
I think that's come out, yeah.
Relational health as well. Because like we're saying, health is holistic. Even if you're doing very well and you have nobody, that's also a challenge in itself, because at the end of the day, you are a social being. So just let's take care of our overall health.
Okay.
Relational, physical, mental, in all the ways that we know how.
All right.
Yeah.
So my last question to you is: you have categorically said that when a situation is, if you're talking to someone and you realize that what they're asking you for is not a normal life stress situation and they need help,
yes,
they should go to a counseling psychologist. Other than yourself, where can someone go to for help?
Okay. I know that in every referral hospital there is there's a unit. For most referral hospital, it's likely to be a youth-friendly center where counseling is actually free. But you need to check with your county to see if that wing is operational.
Okay.
But in every referral hospital, there is a department where counseling is free.
What is a referral?
A referral hospital is just level 4, level 5 hospitals in different counties.
For example, if you were to say Nairobi,
KNH, Kenyatta National Hospital. And local public hospitals, all right, they have something that, and counseling is free.
Okay.
But check with your county to see if it's still operational. But that's standard. Other than that, we have practicing professionals who have their own practices in town, in different places in town. That way, you can get referrals because you might not get to know who has an office where.
Okay.
You can get referrals from I guess people who know people in mental professions and people who use counseling in their daily profession, like people like doctors and police. They can refer you to other mental health professionals.
Okay, so you've talked about the free service. How about what's an average? Is there an average fee? Is there an average fee for those places that are not free? I
would say there's a range. Okay. There's a range where those private practices might fall under. So for Nairobi, because it's different for every county, for Nairobi, I think the range would be anywhere from 1,500 to 3,000
okay.
per session.
Per session?
Yes.
Okay. And if someone can't afford that, then they can go to a referral hospital, as you were saying, Kenyatta National Hospital,
yes.
or a referral hospital in their county.
Yes.
All right. So what we're going to do is, are you available?
I am available. As I said, I'm currently working at Ngewa House as the residential counselor there. However, we still have outpatient services where we do counseling, or we do counseling services as well for outpatient, and that is now open. The residential treatment part is for women only, but the outpatient is open for men, for women, for the youth, and anybody can walk in and get the services that they require. And like we said, if we feel that we're not best suited to support you, then we will refer you to the mental profession that needs to see you.
What would your parting shot be for this day?
Parting shot would be, let's learn to think differently, because our perspectives affect how we feel, and how we feel affects how we live.
Let's learn to think
differently.
Ladies and gentlemen, that was a very, very sober discussion. Thank you so much, Nabura, for joining us today and for allowing us to tackle that topic of how do we remain unlocked in our heads. And as she said, let's change the way we think. Let's use the coping strategies that she gave us. Thinking differently. She talked about having healthy habits. She talked about remaining connected.
Yeah.
Let's do that. And I assure you, if we keep doing this day by day, one day at a time, 1 hour at a time, before we know it, we will overcome. God bless you, and we'll see you next week.